A new study has revealed that doctors are not leaving pro-life states in droves, as proponents of abortion are claiming. The Journal of the American Medical Association looked at practice locations of more than 60,000 obstetricians and gynecologists before and after the Dobbs decision. They found that the number of OBGYNs did not significantly change across policy environments. In fact, the number of OBGYNs increased by 8% in states where abortion is banned, 10% in states where abortion is threatened, and 7% in states where abortion is protected. I had the opportunity to speak with Dr. Christina Francis, CEO of the American Association of Pro-Life OBGYNs, about this study and the false pro-abortion narrative that doctors are leaving pro-life states. Dr. Christina Francis, there were a lot of headlines making claims that doctors were fleeing pro-life states in droves, but we're learning that it just wasn't true. Can you share your thoughts?
Yes, absolutely. Well, Abby, thanks so much for having me on. I appreciate so much. It's good to be back on the program. As you said, I think the abortion industry and its allies has used this lie that pro-life laws will cause OBGYNs to flee states to fearmonger people into supporting abortion when they otherwise wouldn't have. And, we knew that wasn't going to be the case because we know that 76 to 93% of OBGYNs actually don't perform induced abortions. And so for those of us who don't, for the vast majority, our practices didn't need to change when states enacted pro-life laws. But now we have a study that came out in JAMA, which is a well-respected medical journal, that looked at over 60,000 OBGYNs across the country. And they looked at their practice locations from before in the several years leading up to the Dobbs decision and then all the way up until 2024. And what they found was that that narrative is absolutely false. They found that OBGYNs are not leaving states with pro-life laws. In fact, the number of OBGYNs increased in those states at a higher rate than in states that have very permissive abortion laws.
Now, if we could, just on that last statistic of OBGYNs actually increasing the state, what do you think leads to that?
Well, I think there's a number of factors that lead to where a physician decides to practice, certainly. And this study wasn't set up to determine exactly why. It could have to do with taxes in that state. It could have to do with having family in that state or schools that they want their children to go to. But also, what we said at APLOG for a long time is there are a lot of physicians who don't want to practice in states where abortion is done on a regular basis because of fearing being pressured to participate in abortions. And now what we have are essentially sanctuary states for pro-life physicians like myself, where they can go and practice life-affirming medicine and know that they're not going to be pressured to perform induced abortion.
Now, all pro-life laws do have exceptions when medically necessary to save the life of the mother. Yet some doctors claim they're scared to treat women presenting with a case that could require an abortion. There's there need to be more clarity with pro-life laws.
Yeah, this is so heartbreaking to me because, as you said, every pro-life law in the country allows for doctors like me to intervene immediately when a woman is facing a life-threatening pregnancy complication. Unfortunately, the lies of the abortion industry and, the mainstream media and other abortion allies have made some physicians fearful to intervene in those circumstances. And so I don't think, and APLOG's position is not that laws need to be clarified, but rather that physicians need to be provided with accurate information and education so that they will not delay necessary care for women, because women's healthcare is being directly impacted by this misinformation that's out there. And that's actually what led APLOG to produce a medical education video that addresses this exact topic so that physicians can understand and feel confident that they can continue to provide excellent and life-saving healthcare to women no matter where they practice.
That's incredible that you guys developed that resource. Now, Planned Parenthood and other abortion organizations are raising money to help women cross state lines to access abortion. How does this play into the abortion exodus narrative?
Well, this is a really dangerous practice, and it shows actually that Planned Parenthood and other groups that are doing this don't actually care about the health of women. We know that women are at a high risk of suffering severe complications, even from either a drug-induced abortion or a surgical abortion, but these risks are heightened when women then are not with the physician who provided that abortion to follow up for complications, or when they're traveling maybe great distances back to home. In fact, there's a lawsuit right now against an abortionist in Illinois for performing a botched abortion and nearly killing a woman from my home state of Indiana, and then sending her immediately. It was a second trimester abortion, then sent her immediately back across state lines home to Indiana, and she then presented to a hospital here who saved her life. So this is something that we are going to see much more commonly if these groups continue to pay for women to travel across state lines. This is purely being done for political reasons and for this just to push abortion at all costs. And it's being done at the cost of the health of women and, of course, the lives of their preborn children as well.
Well, Dr. Christina Francis, thank you so much for joining us and shedding a light on this misinformation that, as you said, is harming women.
Absolutely. Thanks so much for having me.